A very good afternoon to everyone, all our viewers today. Today, we would be addressing a very, very important health issue that is growing in concern, our respiratory health. And we've recently observed World COPD Day. So I think it's very, very relevant what we're going to talk about today. There are innumerable irritants and polluting factors in the environment today that we are constantly being exposed to, which has given rise to a lot of lung related issues in our bodies today. These effects may not cause only short term discomfort, but they can also give rise to a lot of chronic and long lasting effects on our lungs. To create awareness and to better understand this issue, um, from a clinical perspective, we have brought together a distinguished panel of experts with us today. I am your host, Dr. Radhika Patil, the head of physiotherapy at Jehangir Hospital. Let me introduce our experts today. We have with us Dr. Mahendra Kawedia. He is the senior pulmonologist and head of department of the pulmonology department in Jehangir Hospital. I also have with me Dr. Sanjay Bafna, senior consultant in pediatrics, and he has a specialization in pediatric respiratory diseases and also sleep medicine. We have with us Dr. Aarti Kamat. She is a pediatric sleep specialist and she is also certified in pediatric and adolescent mental health disorders. So I extend a warm welcome to all of you today, and let's begin immediately. I'd like to ask all three of you, maybe Dr. Kawedia can start first. Why is, for someone like me, I've never smoked in my life and I don't have any respiratory issues, but why is lung health then important for everybody?
Yeah, very good question. Even if you don't have asthma, you have not suffered from any breathlessness, or you don't have any respiratory issue, still lung is a organ which supply oxygen to all the organs of the body, like brain, heart, intestine, kidneys, everywhere. Oxygen is supplied through lungs. So lungs are good, lungs are working well, all these organs will also be working well. So if there is not enough of oxygen supplied by lungs, then patient may feel tiredness, weakness, confusion, and all different parts of the body may not be functioning as normal as well. Lung health and oxygen supply to the heart will depend upon the lung health. So even your heart can start failing. You can go into heart failure, hypertension, diabetes, lifestyle disease can start because of the poor lung health. Strong lungs are important to avoid any secondary infections, viral infections, pneumonia, COVID, like seasonal flu.
So they're probably the first line of defense for our body.
Defense of the body to fight that. If your lungs are weak, then you are likely to develop many of the diseases. On your any major surgery, if you want to go, if your lungs are weak, you may not be fit to go for that. So healthy lungs are very important for the overall functioning of the body to have a better healthy life. If your lungs are healthy, if your oxygen level is good, you can have a better lifestyle, healthier lifestyle. You can do many more things which otherwise other people are not able to. So it's not just that you are suffering from some lung issue or respiratory issue or breathlessness and then you remember lungs. You have to take care of lungs all the time for everybody, even for a normal person.
Very, very important point, sir. I'd also like to ask you, yes, please, sir, please.
So, as Mahendra said, taking it further, I think the only nutrient which actually you need in the body is oxygen. So, you need oxygen and glucose, but glucose ultimately is converted to oxygen. So, it is the oxygen which is required, whether you get it from outside or from inside by conversion of glucose to oxygen. So, and therefore, it is important that we have good oxygen for short term and long term health. Second thing is the effect of, as you said, I am a healthy person, so why should it matter to me? Because we all are breathing the same air, and polluted air would have an effect on an individual at a different level. So the air quality level or AQI level in a healthy individual, if it goes beyond certain level, it may be hazardous. But in a child or an adult who has already has some disease or lung problem, that level may be low, but for even for a healthier person, when the air pollution or AQI level exceeds 100, it is going to affect you as well. And
which all the time seems to be the case now,
and
sir.
so we all breathe the same air and we all eat the same kind of food. So all of us are in the same boat, and again the effect may vary, but there is going to be some effect. Aarti, what to add? What Sir said, that why is it important for us to keep our lungs healthy? Even if you don't have an issue, you need to keep them healthy, because if your lungs are healthy, you can handle the atmospheric effects of on your lungs way better. Like I tell people, if you have a cut and you apply a cream, it's going to burn. But if you affect on a normal skin, it doesn't burn. Same if you have a airway which is inflamed and not healthy, you will throw a reaction to pollution and pollutants more.
That's
So
right.
we all have to stay healthy there as well.
Okay. Yes, thank you. Thank you for that clarification. We all know about the dangerous pollutants in the air outside, but sir, would you like to elaborate on these, as well as what about indoor pollutants? Are there any things that can affect people even when they're inside the house?
Yeah, very good question. Normally, what every day on television, on news channels, what we see is the air quality. AQI has gone up beyond 200, 250. Delhi people are choking. All these are the reports of the outdoor air pollution. Of course, they are hazardous, but indoor air pollution is also very important, because many of the people, for 80 to 90% of times, they are at home and they are exposed to the pollutions at a much higher level, because it is confined. Especially it happens in the winter season when the doors are closed, windows are closed, pollutants are inside for a long period of time, and this prolonged exposure to pollutants, if the air quality in the outside is 200, 300, it may be around 800 inside the house, where there are the biomass fuel is being used, mosquito coils are used, incense is used, like loban, agarbatti, dhoop,
So
puja,
all these are
pujagar,
not good for your lungs.
all these are not good for your health. So as less as possible. So having a good ventilated home is very important. Avoiding too much of exposure to fumes, insecticides, or any type of chemicals at home, where we are there for long period of time, is very important. So as much as outdoor pollution, indoor is also equal important, maybe little more.
Okay, that is eye-opening actually. Yes, I was just about to go to Bafna sir with that question. Is that how commonly do you see lung-related issues now in children, and what are those? So, particularly related to pollution, if you are saying, then as Mahendra was saying, indoor air pollution becomes very, very more or very, very important in children, because in infancy or children when they are very small, most of them are confined indoor. They don't hardly go out, and therefore the role of indoor pollutants, apart from the biogas fuel, you have heating systems, you have cooling systems. So the way you are operating your kitchen, the cooking appliances, the way so even the normal gas would create a lot of the gases and the particulate matter. Even your ACs, your furniture, when you are constructing the house or the furniture is going, that all those chemicals which are used, the cleaning material which you are using, detergents and the chemicals which you are using, and sometimes we use pesticides even in the gardens and for mosquito repellent. So all these which are not seen or not talked about. So indoor air pollution is something which is, we always talk about air pollution outside, but indoor is equally important, very important in pediatric age group, because they are exposed, and even for pregnant ladies who are exposed to this will lead to effect on the fetus. So we are pediatricians, so we talk about that. And then the lung diseases which we see as a result of this bad is of course infections. So we always associate infection with the germs, but your immune system gets affected by the pollutants or your air pollution, and therefore you are not able to fight that infection well, and therefore pneumonias, respiratory infections also will be more if you are staying in a polluted or air.
And of course, allergic disorders like asthma and other allergic disorders will be on rise, and we all know that they are on rise. So these are the conditions. Apart from them, routinely, of course, we see a lot other lung conditions, but they are not related directly to the lung. But congenital malformations, we do not have whether there is a link between pollution and this malformation. So all these kind of and sleep disorders, I think I would hand it over to Aarti to talk about sleep, because sleep issues are also seen.
Yeah, so asthma and sleep, they're related, I think. And
It's actually bidirectional. Asthmatics have disturbed sleep. And independently also, asthma can cause sleep disordered breathing. And if a child who is not sleeping well and is stressed will have more of an attack. So it's bidirectional. Now, if you have a child who has a blocked nose or he has an itchy nose, he's not going to sleep well. So uncontrolled asthmatics and sleep, allergy, sorry, have a very profound effect on sleep in children. So
it is important to treat allergies.
Extremely important
Because
to treat
what
allergies.
earlier used to be said कि हाँ allergy है ठीक हो जाएगी.
And now we see if a child is coughing, the parents come to us. But if it's a cold or he has an itchy nose, they say, no, it's just a cold. So cold is never taken into too much importance, but the children suffer. Imagine if a child gets up every morning with a blocked nose. He's sleepy, he's sniffing in school, he's called names, he's not being able to perform well. So it has a lot of consequences in their, in school especially and home, but school too and academics as well.
And I've heard also that sardi जो बोलते हैं ना, that slowly turns into asthma. Is that right?
So
Or
like
if you leave it untreated, I don't know. This is what I'm.
you have an upper airway and you have a lower airway. Now, if you think of your upper airway as the roof and your lower airway as a floor, if you have a leaky roof, it'll come to your floor, right? So perpetually, if you have allergic rhinitis, eventually you will land up with wheezing because it's the united airway, it's the same track.
Correct.
That's why you correct it properly. Is there anything else?
No, absolutely.
Yes. So, how do parents then differentiate? Normal सर्दी खांसी है, कब जाना चाहिए डॉक्टर के पास?
Yeah, so commonly, as we always tell the parents, common cold and common cough means routine respiratory, upper respiratory, as Aarti was telling, the respiratory tract, which has an upper respiratory component, nose, throat, and the up to your main broad airways. So the common respiratory infections, 5 to 6 in a year, up to 5 years, they are common. And the child would be having some cold, cough, and mild fever, and he's otherwise breathing well, happy. In between the fever, he's otherwise okay, eating well. You don't probably have to worry, and of course, don't give too many medications. We already had a lot of discussion on cough and cold medications last month. So they are self-limiting. You don't have to bother about them. But at the same time, you need to look at the danger signs. So what are the red flags or danger signs? When the child is running high-grade fever, when the child is having breathing difficulty, he's not breathing well, his sleep is disturbed, and of course he's not himself, like his sensorium, the consciousness is affected, or he's now lethargic. All these are danger signs, and you should not be waiting too long in those situations. And of course, any child who is breathing heavy or having noisy breathing is a sign that you need to go to a doctor immediately.
And also, I'd ask another question related that regarding the treatment. When you prescribe inhalers and you give nebulizers, then sometimes parents feel that it can be addictive. So, is that true, and whether they should be using them?
So, addiction is basically a function of the substance which you are using. Okay. Addiction is not the function of how you are taking it. So, I always tell my patients that you can drink water from the glass, but you can also drink something else from the glass. So it's not the glass which is a problem. What you are drinking is a problem. So inhalers are just the way of giving medications in a different manner. When you have an eye infection, you put eye drops. When you have a skin infection, you put skin ointment. Similarly, if you have a problem in the airways or the lungs, you put the medicine directly there so that it does not reach anywhere else and does not cause problems in other areas. You give medications by, when you swallow it, 90% will go to kidneys, liver, lungs, other organs, and it will cause side effects. So, in fact, it is safer and better way of delivering, and therefore it is the standard of care. And we must use inhalers, not oral medications or other ways. And they are not addictive because the medicines which we are using have been used over a long period of time, and they do not cause any side effects or addiction. Because addiction, as we always said, addiction is something where you cannot do without it. You cannot do without medication because your disease is such. So we, over a period of time, we are able to wean them off, and nothing happens. That means they are not addicting. And nebulizer should not be used. Of course, inhalers are the way to go. So we must use inhalers and not nebulizers. Even home nebulizers should not be used.
And it's a very easy way of administering the drug as well.
Very easy way, absolutely. And it's very safe, easy, effective, and the right way.
Yes, thank you, doctor. And I'd like to ask Kawedia sir now.
One more thing in
yes.
that, the dose of the medicine, what we are going to use, because almost 5% of what you would otherwise give as a parent, as through the stomach.
Okay.
And the receptors are present in the bronchial airways.
Okay.
So the site of action is in the bronchial, in the lungs.
The
where
medication
medication
reaches quicker.
at the site of receptor. So that is even the called steroid receptors, beta 2 agonists, all are in the airways. So there only molecule reaches at the 5% of the total medicine which you would
Okay.
otherwise give orally.
Yes, that's a very important point. Sir, while we are on the subject of children, adolescents, we find that smoking is still common and vaping has become very popular now because people think that vaping is a safer form of smoking. What comments do you have on that?
Yeah, as everybody knows, this cigarette smoking is very dangerous. It contains almost 4,000 different types of chemicals which are proven harmful to the body. And out of them, almost 200 are carcinogenic, known carcinogenics. Still, people are smoking because what it contains is the nicotine, which is most addictive form of substance ever known to the people, and that is it becomes very difficult for them to get out of that. If it is started in the early age, like 14, 15, school age or teenage, then it becomes very difficult. And as the age advances, the same kick what they give with this one smoke, one cigarette is not going to get it's in the same after next year or 2 years. So it goes on increasing the dose. So by the time he reaches 35, 40, he's already smoking too many cigarettes. And there is an index how many cigarettes you smoke. And depending upon that, there are different types of lung diseases it causes, like COPD, which is a chronic obstructive pulmonary disease, which occurs in the later ages of life. But if it started early, you can get it early. There is something called a lung aging. As our chronological age increases, the lung age also increases. So smokers, normal our lung capacity is maximum at 25 or 30 years of age. And after that, every year there is a small decline in the vital capacity, about 1.30 ml, not more than 12 to 15 ml. But in smokers, there is a fall of almost 30 to 50 ml per year. So this fall in the lung capacity, vital capacity every year makes that person much more older at early age. That is very bad. And now what people started doing, nicotine is bad, no. So what I will do, I will remove the nicotine from this. I'll put a flavor. So what they are adding is something, and that is the beginning of vaping. And vape also contains a lot of chemicals. One of the chemical which is used as a diluent or as a vehicle is a formaldehyde. Formaldehyde is a liquid which we use for storing our dead bodies. So you can imagine how dangerous it can be. People can't go near that smell also. And that kind of molecule, solvent is used for as a delivery molecule for that vaping. Then they put all Ayurvedic, Bhindika Patta, Vetika Patta, and all these try to make them Ayurvedic or safe. But it is now it has been proved. There are many lung diseases, vape associated lung diseases have been found. Although doesn't contain nicotine, but the kind of chemicals which are used in vape, they are also harmful. It may not cause asthma, but it can cause lung fibrosis, which is more harmful. It can cause hypersensitive pneumonitis, which can lead to fibrotic lung disease, and ultimately we can reach up to the lung transplant. So vape is not safe.
And the saddest part about vape is it comes like a USB stick. You can that school children are being caught with vapes now because it's so easy to carry and they're flavored, so there's no smell after you vape. So the addiction is really increasing. So vaping, though it's banned in India, vapes are available in India, unfortunately.
Yeah, you can continue probably since you.
Still talk about it, but like what Kawedia sir said was very true that if a child starts vaping early on, or they get into any addiction of these substances early on, they're gateway drugs. Once a child does vaping or cigarettes, it is a gateway for other drugs later on in life. Because when you do these things earlier, your dopamine receptors proliferate. And what unfortunately, what one cigar gives you a dope, and dopamine means a feeling of high, that next time two will be needed, then three will be needed. So it just goes on increasing. And vape being very easy to carry is it's adolescents are really falling into vaping, and unfortunately 9th, 10th, 11th, 12th students are coming with vapes now, which is very, very sad reality.
Very dangerous, very dangerous. Yes, thank you, ma'am. I'd like to ask Dr. Kavedia again. Should people undergo lung screening or pulmonary function tests, or at some point, or what point in their life should they be looking at what their lungs are?
As we have seen the importance of lung in the overall health, there is no need to wait for us to develop a lung diseases or cough or breathless to do a pulmonary function test or what is called as a spirometry. It gives, and as I told you, the lung function also goes on decreasing after 30 or 25 or 30 years of age. So for a general population, at least once in a lifetime after 40 years of age, you should do a lung function test to find out what is your lung capacity. And after that, he can do every 2 years and see to it that it is not dropping very fast. If it is dropped very mild, then it is okay. But especially people who are having COPD, asthma, for them, you need to adjust their treatment according to their lung function. So they require to be done at 6 months interval, 12 months interval, something like that. But when the person comes with your symptoms of respiratory like cough, cold, fever, breathlessness, then that is the immediate you have to do a PFT. And without PFT is like a ECG for a cardiologist. Without PFT, it's not a good thing to treat the patient because you will not know what was his condition before starting the treatment. You can directly demonstrate the pre-treatment, post-treatment, and see the result. That is the time when you can show the patient, show him the severity of the disease and the importance of the medication, so that he gets scared. Why, how it is. If it has happened with smoking, then he will know that his lungs are getting damaged. So it is very important parameter to decide what was his normal lung capacity and to do a PFT, pulmonary. It's a simple test. You have to just blow in that blower turbine. It analyzes the amount of air you exhale, the speed at which you inhale, how much air you enter, and what are your predictable as per your age, height, weight, sex, and how much percent of it is your capacity.
Very simple and done in 5 minutes. Yeah.
Non-invasive, you don't have to take any injection or no dye, no reaction. The only thing while doing you may feel little dizzy. Otherwise, it's very, very safe.
Okay, thank you, sir. I'd like to ask both the pediatricians now. Are snoring, coughing at night, are these common symptoms in children, or should we be worried about if that happens?
So snoring is common, first thing, because almost to the tune of 7 to 10% of children would snore. That's the normal prevalence worldwide, and that means out of every 10 child, one child would snore. So what does snoring tell you is snoring is telling you that there is some noise which is coming when the child is breathing. So probably there is some obstruction. So yes, it is common. So when it is significant or when it is problematic, when the snoring happens very frequently, that is, habitual snoring happening more than 3 times a week is habitual snoring. And out of these children who are snoring, 7 to 10% we said. So almost 10 of, if you take 10 children who are snoring, out of that 1 to 2 would have something known as obstructive sleep apnea or a real problem breathing at night. So So we are talking of snoring which is normal to the snoring which is abnormal, and the abnormal snoring is because he is not able to breathe well. His airways are getting obstructed, or breathing becomes obstructed at night. So is snoring normal? Maybe 7 to 10%. Is it dangerous? Yes, because out of these children who are snoring, 1 to 2 maybe out of this 10 may be having something which is need to be seen or analyzed or evaluated by a pediatrician. So any child who is snoring, take him to a pediatrician, pediatric sleep specialist or pulmonologist for evaluation, because it could be beginning of an obstructed sleep disorder breathing.
Yeah. Okay, Dr. Aarti, elaborating on that, are sleep problems with sleep or sleep disorders and related to breathing issues and anxiety and behavioral issues?
So, like Sir said, if 7 to 10% children have normal snoring, but there are 1 to 2% who have obstructive sleep apnea, the sleep disordered breathing. So, if a child has doesn't have good sleep or has disturbed sleep or has an obstructive sleep apnea during the day, the younger children are very hyperactive. They are jumping around. They are falsely labeled as having ADHD. The older children are inattentive because of lack of proper sleep, and they are taken as being defiant. Academically, they're going down, they're very sleepy in school. So, all of this affects their behavior and their academics. And in older teenagers and older children who have a lot of pressure of studies, will cause anxiety and stress. So, yes, it is all interconnected finally.
So, how can parents create a healthy and safe sleep environment for children?
So, like I think Bafna sir and me did a sleep podcast around a month back, and we said the most important thing is sleep hygiene. So, sleep hygiene is a consistent bedtime routine. So, there's so many parents who come and say, "No, my child is asleep before 10 o'clock. He comes up from his playground at 8 o'clock." But that's not correct, because children's upper limit of bedtime has to be 9, and it has to be same on weekdays and weekends.
No one has heard of 9 p.m.
In India, 9 actually, it's 8:30. But that's the whole thing. That's why we're having an epidemic of children who are not sleeping well, who are tired, who are getting hyperactive, who are inattentive, who are fatigued. So this has to somewhere reach everybody that sleep bedtime routines are mandatory, and you have to maintain it even on weekends. Because if you sleep more on weekends, you can't compensate for the week. You can't eat one roti on Monday and then eat 10 on the weekend. Same happens with sleep. So consistency is the key in sleep routines. And I think that's extremely, extremely important, because sleep affects your asthma, your allergies,
That
your
you do.
every organ and everything. So I think it has to be looked into for sure.
Okay. So, Kawedia sir, would you like to?
Just
Yes.
the point
Yes,
about
sir.
snoring, and I did not want to make it lengthy, that's why I stopped. So how do you identify abnormal snoring? The parents should know that the child who is restless at night, who is getting up again and again, who has bed waiting after the particular age, or he's sleeping in an abnormal position. These are the signs. Or and then of course extremes are when he's gasping, he gets up and starts breathing like this, so abnormal breathing pattern. All these are signs that this is not a normal snoring. Same thing in the effects of this, because the child is not sleeping well. The effect we have already discussed about the behavioral issues and the hyperactivity. And when he gets up in the morning, he is not fresh. He has headache, or he's and then attain academic performance which is going down. So that is how we link what is normal snoring and an abnormal snoring. And I think any child who is snoring need to be told at least to a pediatrician, and so that they will take it further.
Yes, sir.
Yeah, the one aspect of snoring and sleep OSA or obstructive sleep apnea is that it is causes the less oxygen. It is harmful to the body for that child. But same not only to that particular person, but the person who is OA, obstructive sleep apnea, or not snoring continuously, he becomes daytime sleepy, and that is dangerous for not only for that person but for the society also. If such person in an adult or in is driving, then he can cause accidents. We have seen the people, normally we assess these people from the degree of awakefulness during the daytime.
Okay.
What they are doing at night, how much they are snoring may not be that much relevant. What is important is daytime sleepiness of those patients is very. If we are doing a podcast now, and some unrelated person sitting in the auditorium, and he goes to sleep, which is quite natural. So you cannot call him OS.
Okay.
But
I
a
think
person,
we've all been there and done that.
but if some student is sitting in this, I can see some students sitting. If they go to sleep, that means it is a mild OS. If a person who is recording our speech, he who goes to sleep, that becomes a moderate apnea. But if one of us goes to sleep, that becomes a very serious.
That's
So
very
you can
serious.
so you can decide that way.
Okay.
How the person while driving also they can go to sleep and create accident.
That's true.
So that
yes.
is the
That has
severity of,
happened
and this
so
has
many
been
times.
happening.
Yes.
So daytime sleepiness is very important parameter to judge the OSA and requires immediate.
Okay.
As I think Aarti was saying, daytime sleepiness is a very important symptom in adults who are have OSA. In children, it becomes other way. Like instead of means, of course, daytime sleepiness would occur in some children, but they may become hyperactive and they may have behavioral issues, and then so irritability. So they are irritable because they are hypoxic and maybe so. Sometimes you may not get daytime sleepiness, but you get a hyperactive child.
Okay, very important point.
Another thing is when a child doesn't sleep, the entire family does not sleep.
Yeah, of course.
So everyone is affected. So it really has to be taken care of.
Right. We've talked a lot about risks. We have talked about pollutants. We've talked about what to check. We've talked about treatment. I'd like to ask you, sir, Kawedia sir, Bafna sir, Aarti ma'am, what can we do then to keep our lungs healthy?
So,
So that it doesn't come to, getting treatment.
So, I mean, common things, of course, applies to whether it is lung health, cardiac health, or any bodily health, overall health. Holistic approach is what is important. So, when we are talking of lung, of course, we talk of air quality, but it is overall health which is important, and therefore, your exercise, your routine, your sleep, your diet, and everything comes into play when we are talking of health in general, and lung health particularly relevant from air quality point of view. And it's not only the lungs which get affected because of air pollution, particularly in children. It is the brain. So because the infant brain is growing, our brain cells are still growing. Your lungs is also actually, so the lung health is very, very important from a pediatric point of view, because your lungs, as Dr. Kawedia was saying, that your lung function actually goes up at till adolescent, and then it starts declining. So your alveoli are still forming, your brain cells are still regenerating, and therefore all these environmental pollutants have an effect on your immune system, your lungs, and your brain. And therefore it is very, very vital for pediatricians or children. The effects are much more diverse than only lung. How to keep them healthy? As we have said, a holistic approach. And second thing is, of course, improving the quality of air pollution. I think it is a big task. It is administration job, but all of us, if you ask us, all of us can contribute in some way or other, pulling using public systems for transport.
That's a very important point, sir. I think all of us can do our bit.
We can do a bit. So carpooling, using public vehicles, using vehicles which are creating less of air pollution. So now there's electric vehicles and all those are coming. So how we can contribute is a big subject. We're not going to details, but each one of you or us can contribute to reducing the air pollution and improving the quality of life. Indoor air pollution we have already spoke about, and there are a lot of things which we can do where we can reduce, reuse, and recycle. I think it is the funda which we can use, and therefore less of consumerism or this thing consumption can also reduce, because we said furniture and your products and household products and your ACs and your lot of things where air pollution is not seen. So all this, and then of course the last important, the advocacy. You need to do advocacy, and the advocacy should start at home. Treat or teach your children these small, small, simple things about air pollution, about reduce, reuse, and recycle, because that's how I think the future generation would take it further.
Absolutely. And I think the positive part is I think they are very interested in these things. They, in fact, yeah, they come back and they tell parents how to behave at home. So it's wonderful if that is happening. Kawedia sir, please.
Yeah, very nice explanation he has given about what the people can do, or as a community or as a government can do for capacity. But what we can do for our lungs is also very important. We have to keep our lungs healthy. Start doing deep breathing exercises, pranayam, yogasan, alom vilom. These are the exercises which will strengthen your intercostal muscles, lung muscles, your lung capacity will increase. So this is one thing which you can don't wait for something to happen. You can start keep have a good diet which will rich in proteins, nutrients, so that you get your muscle mass is preserved. This is very important. Second thing, people who are having lung issues or adults above 40, 50 years of age, what is important is a adult immunization for the prevention of the flu, prevention of the pneumonia. Very effective vaccines have come, flu vaccines every year, and you have 60% less chance of getting flu. Pneumonia, single vaccine, and you are free from pneumonia almost, or your chances becomes very less. So these are all personal level you can help yourself by avoiding infection, by strengthening your lungs. That is very important.
Yes, I'll just add my 2 cents to that, sir. Since we do see patients for pulmonary rehab, so what sir said was very, very important. Like doing deep breathing and pranayam are extremely important because they strengthen the lungs, yes, and they also improve the elastic recoil of the rib cage, which is very important. But I would like to stress very much on the benefits of aerobic type of exercise, because when you raise your heart rate, that is when you create the demand for oxygen. And doing pranayam sitting on a chair does not do that. So you have to create a demand for oxygen in the body so that the lungs start, pumping harder, the heart starts pumping harder, and that helps in the long run a lot. So aerobic type of exercise, anything moderate intensity, is very, very good for the body. So you can elaborate if you'd like.
Very good take home message. I think this is very important. Unknowingly, you are helping your lungs by doing the
Correct. Because if you're very slightly out of breath, that is the feeling we would like to have, not gasping, but slightly out of breath. That is called moderate intensity. And that really helps the lungs to and the heart to grow stronger.
Only you are also utilizing that potential, because your potential is, if I don't, climb the stairs, 3 stairs for 10 days, the
Yes.
next time I climb,
Yes.
I'm breathless.
Yes.
So I think if you keep doing that exercise, small, simple exercise like climbing the stairs, not using lift,
Absolutely.
all this will keep you healthy, and I think very important.
Just to say that all many parents ask what can we give for immunity? What can we give to decrease respiratory infections? Well, there is no quick fix. It's sleep, it's nutrition, and exercise. 3 pillars which will increase your immunity. There's no drug over the counter which can do that.
It's not contraindicated for children with asthma. That is
They can
also
even
I'd like to
play
ask.
Olympic level or any kind of competitive sports if they're well controlled.
Okay, great. So, is there anything else we would like to talk about or add? I think we've covered a lot of really great topics in short, but
Advice is to take care of the lungs. Lungs will take care of you.
wonderful. Yes. On that note, are there any
Thank you,
questions
Radhika.
here?
I think it was very, very wonderfully moderated by Radhika, and I thank Mahendra and Aarti for their insights. Thank you so much.
Thank you. I will just wait for a little bit more because I think we have some questions from the audience. Yes. Yeah. Yes. So let me just open that. Yes. So Mr. Millind is asking if a child is coughing and breathing fast after running or a sporting activity or dancing many times but not daily, then how do we analyze whether he's suffering from any allergy or asthma?
So I think a very, very important question, and very important observation, I would say, because one of the important myth regarding asthma or allergic diseases, my child is not breathless. in asthma, in Marathi, asthma or dama is, breathlessness. So my child is not breath. How can you say that this child is suffering from asthma? So the important thing is the only symptom, the most important symptom for asthma is cough. And that cough may happen after viral infection, which goes on for a long time, or you may cough only during activity, exercise, or vigorous activity. So if your child is having cough most times of the week after activity or has breathlessness, which is disproportionate to other children. Other means if you do a vigorous exercise, all of us would become breathless to some extent. But if you compare to his age group children and if he's breathless on activity which other children are easily doing, or peers are easily doing, or he's coughing every time he does that activity most of the time of the week, you need to get evaluated for asthma, because this is the typical feature of asthma, the cough which comes on activity, exercise, or exposure to triggers like air pollution we spoke about.
Cold air or air
Cold air.
pollution. Yes, very important point that. Yes, thank you very much. I think there are no more questions from the audience. Yes, I very warmly thank my panel of esteemed experts here, and I hope we come back together sometime and talk more about this important thing. But that's it from us for now. Very good afternoon, and thank you for joining us today.
Thank you so much. Thank you.